Hi, everybody. Thank you for joining our Facebook Live with Magnolia Creek. This is our Eating Disorder Connection series, and we are live and connected today with Suzanne Arnett and Maria Lampley. Our eating disorder network of services comprised of Magnolia Creek, Selah House, and Toledo Center for Eating Disorders meets clients where they are in their recovery. We provide the necessary therapeutic techniques to empower sustainable freedom, and our expert clinical teams just really help clients understand that recovery is possible by using individualized treatment plans comprised of a combination of evidence-based treatment modalities. Our goal is to make each client feel safe and close to home by conducting all levels of treatment in comfortable home-like settings. We really design a clear step-down process so that patients are really well equipped on that transition home, and they just feel continually supported in their recovery journey. Today we have Suzanne and Maria from Magnolia Creek, and Magnolia Creek is our treatment center located just outside of Birmingham, Alabama. We treat adult women, and we really specialize in co-occurring mental health and co-occurring addiction at Magnolia Creek. We use evidence-based treatment, which Maria is here to talk about today, CBT, DBT, IFS, along with several other modalities, just to help really come alongside each of our women and help walk them through their journey. So without further ado, we have Suzanne Arnett. She is our Regional Director of Clinical Partnerships. Suzanne lives in Mississippi. And Suzanne, welcome, and I'd love for you to just introduce yourself a little bit and introduce our guest, Maria.
Absolutely. Thanks, Kayla. Hi, everyone. I'm Suzanne Arnett. I'm the Regional Director of Clinical Partnerships at Magnolia Creek. I live in Mississippi, as Kayla said, and travel throughout the Southeast, working with our 3 eating disorder programs in our eating disorder network at Odyssey Behavioral Health. So I'm thrilled to introduce y'all to my coworker, Maria Lampley. She is a certified eating disorder specialist and an awesome therapist. And Maria, to kick it off, kind of let everybody know who's not in our industry, what is a CEDS or certified eating disorder therapist, and how does that help our clients?
Well, the point in even pursuing and getting that certification is to assist our clients in their path to recovery. A lot of times they come to us and they have gotten to a place of surrender. A lot of them haven't. So as a certified eating disorder therapist, our role is to walk with them, alongside them, and help them figure out the answers that they have to their questions. Can I recover? Will I ever be normal? Will I ever have a healthy relationship with food? That is our role here, is to assist them through that journey of getting those answers that they need.
Wonderful, thank you. You know, many of our clients come in with not only an eating disorder, but co-occurring addiction, and trauma can be a large part of that piece as well. How do you approach the treatment of co-occurring substance abuse and trauma along with that eating disorder?
Right. So when they come in with different diagnoses, we sit down together, the therapist and the client, and we determine overall goals. We also look at specific objectives. And then we collaborate to determine the best interventions, whether that's cognitive behavioral therapy, dialectical behavioral therapy, EMDR, things that will cater to their specific therapeutic needs. And every week, we meet with the client twice to address those objectives and to walk together to ultimately meet those objectives before they discharge. That's always the goal, is to point them back to their blueprint, and their treatment plan is their blueprint.
That's exactly right. And I know a large part of our role is to help you guys as far as discharge planning goes, and being able to ensure that those clients have appointments when they leave Magnolia Creek to see their home therapist, or if they don't have a therapist, we help find one. Same with the dietitian, psychiatrist, whatever their needs are. That's a huge part of what we do as well. Now, I know you've done some training in EMDR. And specific to trauma, are there other modalities you can use in addition to EMDR to help our clients that come in with trauma that seems like they've had their lifetime?
Sure. We also utilize IFS. That is another modality. And with IFS, we really focus on self. And self is an agent of transformation. It lends itself to self-help. So we know that when clients discharge, ultimately it's their effort to continue that progress in their recovery. And the more confidence that they have in their own ability to not only implement coping skills, but to use their voice for support, to use their voice to say, I'm struggling, or I am vulnerable right now. We want to help our clients find their own voice and to build their self-confidence, to know that I am worth recovery. I am worth the time and the effort and the energy to invest in that process. So that's definitely another modality, because trauma, we know, it debilitates a person's voice, a person's self-worth. And through IFS, EMDR, CBT, DBT, and other modalities, we work we not effortlessly, but we use every effort to make sure that the client knows that it's okay to invest that time and to spend that energy to get better. Because after they leave us, their journey doesn't stop. It continues. So with those modalities, our ultimate goal is to equip our clients.
Right, that's wonderful. I'm just curious, out of all the things you could have chosen to do as a therapist, why did you choose eating disorders? It's not exactly an easy field to work in. I would think rather challenging.
Well, I want to grow and develop as a clinician, as a professional helper. And when I came across the opportunity at Magnolia Creek, it actually reminded me of a time in my life where I also struggled with bulimia. Now, as a woman of color, as a Black woman in the community that I grew up, eating disorder is foreign. We don't even talk about that issue or that condition in those words. So just having an opportunity not only to learn more about eating disorder, but to revisit that experience that I had and to put a name to it, I think that was invaluable for me personally, but also it gave me an opportunity to take my own experiences and to remind myself as I meet with each individual client that I've also had that time of struggle and challenge in my own life. So, you know, this opportunity at Magnolia Creek has been tremendous for me, not only as a clinician, but as a woman, as a person with challenges like that.
Thank you for sharing that. That is powerful to hear. And I know our clients enjoy working with you as well. Now, if we've got someone watching at home right now who maybe has an eating disorder, or perhaps it's a loved one watching, and are contemplating treatment or contemplating seeking help for the first time, what would you say about Magnolia Creek? What is the Magnolia Creek difference? How are we different?
The atmosphere, the environment, it is a respite from the life that has brought them to that place of, I need help. When you come here to Magnolia Creek, you have an opportunity to focus on yourself. You don't have to be the wife, the mother, the teacher, or the doctor, or whatever roles, whatever hats that person is wearing now. Magnolia Creek gives that person an opportunity to rest and to heal and to recover and to really focus on themselves. And that self-care in this environment is unparalleled, in my opinion. So I do believe that not only do we offer excellent services, but the environment in which we offer those services is absolutely beautiful and serene and tranquil and peaceful. So I would definitely recommend this setting as an opportunity for recovery.
It is a beautiful place indeed. Indeed it is. Well, thank you for all that you do for our clients, and we appreciate it. I know it's been difficult, probably are a little more challenging the past few months with COVID going on, but we certainly appreciate you and all you do. Kayla?
Thank you guys so much, Maria. That was such wonderful information, and we know our women who come and interact with you are just blessed every day to have you as their therapist and have you walking alongside them as part of our Magnolia Creek difference. And so we are so thankful for you. And for more information about our eating disorder network of services, or if you or someone you know is suffering from an eating disorder, we are here and we're ready to help. You can visit our website at www.magnolia-creek.com, and you can get more information about our network of services, or you can contact our admissions teams. That's 24/7 at 765-641-0022. You can send us a private message on social media, Facebook, Instagram, Pinterest, or LinkedIn. So there are plenty of ways to reach out for help. And sometimes it's just trying to get a few questions answered. We do invite you to join us next week. We'll have Toledo Center for Eating Disorders on our Facebook Live, our Eating Disorder Connections program. That is Wednesday, June 17th, 2020 at 12 Eastern. That it will be on the Toledo Center Facebook page. So if you're not following Toledo Center for Eating Disorders on Facebook yet, go there, click that thumbs up, and next week you'll be able to meet our clinical director, Megan Desmond, and our regional director of clinical partnerships, Kara Pate, on that page. And we'll just be talking about our specialized approach to treating males with eating disorders, because in our network of services, we have female-only facilities, and we also have facilities that can serve the male population as well. And just from Maria and Suzanne, myself, the entire network of our eating disorder care, we just thank you for joining us today. We are here, we're ready to help. We invite you to walk with us into freedom, and we hope to see you next week.